Say
So,
loudly.
good afternoon. Myself, I am Dr. Balam Reddy. Today we are going to talk about prevalence of sexual dysfunction in alcohol dependent patients. So, introduction: alcohol surrounds around that it became most popular drug of abuse in 21st century. Sexual dysfunction is the most quite common in general population, with 1 in 5 males suffering from it. So, alcohol is long regarded as a risk factor for sexual dysfunction. So chronic usage of alcohol generally affects on general population endocrine dysfunction, like hepatic endocrine. The patient consumes alcohol. Advancing age, educational unemployment, cigarette use may be other cause of sexual dysfunction in men with alcohol dependence. The main aim is prevalence of sexual dysfunction, alcohol dependence syndrome. The objective is that to study the frequency, nature of sexual dysfunction in male with sexual alcohol dependence syndrome, to study the relationship of sexual dysfunction to a socio-demographic profile and clinical variants in men with alcohol dependence syndrome. So the material, the inclusion criteria: married men currently having stable heterosexual sexual partner. Age is 25 to 60 years. Willingness to give to the consent to the part of study. So, next exclusion criteria: the history of primary sexual dysfunction is excluded. Along with that, psychiatric disorders that can potentially cause sexual dysfunction. Dependence on substance abuse other than alcohol should be, except for tobacco, should be excluded. Use of drugs with known sexual side effects like antipsychotics, antidepressant, antihypertensive, steroids and disulfiram would cause sexual dysfunction. So these drugs should be excluded from the study. And other comorbid organic physical disorders by examination, history and relevant investigation like cirrhosis, hypertension, diabetes, endocrine disorders and the systemic illnesses. History of genital surgery, trauma, spinal cord lesion should be excluded from the study. Basically, it's a cross-sectional study. The patient were assessed only at once in whole study. Tools used in the study is ICD-10 criteria for alcohol dependence syndrome and ICD-10 criteria for checklist and modules. The intake proforma, the specific proforma designed to the study to evaluate socio-demographic profile, alcoholic-related variants like age of initiation, onset, duration of dependence, amount and preferred drink, complication, nicotine use and family history for alcohol use. And alcohol dysfunction checklist. The checklist is used to find out the presence and types of sexual dysfunction. It contains 12 areas of sexual dysfunction in the diagnostic criteria for ICD-10 classification of mental and behavioral disorders. The tools specifically used are changes in sexual function questionnaire, male. It is that thing that we use here, and erectile function scale. So when we come to the results, we took 120 sample, but in 120 only we have the sample is 75. Other samples who are not giving consent and having some which are included in the exclusion criteria will be excluded from this. So we'll be discussing from the discussion point of view. So the studies participants are chosen for the from consecutive male patients of ADS. The patient who are under the alcohol dependence syndrome criteria who are meeting, we choose those patients for assessing sexual dysfunction. In current study, the prevalence of sexual dysfunction significantly high in comparison with prevalence of sexual dysfunction in general population. The person who is alcoholic tend to have alcohol dysfunction when compared to general population. In current study, the most common affected domain in sexual dysfunction was reduced sexual pleasure, following by reduced sexual desire frequency, sexual arousal, excitement, and sexual desire, interest, and sexual orgasm completion, which is in a descending order. So, in this study, we will be discussing about the data that was we have in the present study. We will be comparing with the previous studies. So, however, the current study found diminished sexual pleasure was the most common sexual dysfunction, that is 71%, when contrast with the previous study, which showed the dysfunction is most common, like erectile dysfunction is most common in the previous study, but in our study it shows that decreased sexual pleasure is the most common dysfunction that we find out. The reduction in the sexual desire in terms of frequency was found out to be 61% 5% in the current study when compared to the previous studies. The current study provided sexual dysfunction 43.6% the patient with alcohol dependence when compared to 59% in the study which was done by Mendel and Miller. The prevalence of reduced sexual orgasm was similar to this study. The reduction in sexual desire interest was found to be 55% in the current study when compared to the previous study which was done by Vijay Sanan. And Ferrer reported 75% of prevalence of sexual dysfunction in the male with alcohol dependence, which was close to the same domain in the current study. That was 71%. Having low sexual pleasure. In our study, the prevalence of sexual dysfunction was 71.8%, the least domain, and erectile dysfunction is the 43%. So, sexual pleasure is in our study we finally found out was sexual pleasure is decreased in alcoholic patient in our study when compared to other studies which we found out that erectile dysfunction is the most common. So in our study we found out sexual pleasure is decreased component. When we come to the conclusion, the most sexual dysfunction we found out to be is sexual pleasure, that too 71.8%, following the low desire following by decreased desire, that is 61.1%. So sexual in terms of interest was 55.1%, followed by sexual arousal acceptance was 59%, and sexual arousal completion was 48.47% in the alcoholic male. So erectile dysfunction was 43.6% in alcoholic male patients. So previous studies, and when we compared the previous study they are saying the erectile dysfunction was the most common sexual dysfunction in alcoholic. But in our study what we found out that the sexual pleasure is the thing which is most common in the alcoholic. That's the contract when we compared the previous study. And thank you.
Very good, very good. Very good, friend. Anyone want to ask any query, any questions?
The sexual pressure also decreases in females also, is it?
Yeah, but we took the sample. We took sample male patient who are alcohol dependent male patient. Like Sark took on with female, you took on female. Both that was depression, but I took only
Because of some depression on females.
female.
Your case was only the depression.
Yeah, only depression.